playing out. Give us an indication of where we are now, perhaps contrasting it to where we were a couple of years ago.
Well, we know that we're in the midst of an epidemic which is now matured. And so what we're finding is that we've got about 1,000 infections a day and about 1,000 deaths a day attributed to HIV and TB. And so that obviously then has a massive impact on our economy. And because most of the people who are getting infected and who are dying are in the working part of their life, this is having a very significant impact on business.
Well, Brad, what kind of impact is it going to have on productivity? We keep saying that in South Africa we need to start upping our productivity levels. The truth of the matter is that life expectancy is dropping dramatically as well. So we are starting to lose workers. We're starting to lose a lot of our workforce. How do you see that playing out? Is it going to be a crisis down the line, or are we already in crisis mode?
Look, I think that there is light at the end of the tunnel in terms of seeing how government and private sector are responding to the epidemic. But I think that we're going to experience the worst of the epidemic for a couple of years still to come. We know, for example, that the South African GDP is pulled back by between 1% and 1.5% as a result of the impact of HIV. By far, the greatest cause of absenteeism in the workplace is attributed to HIV and TB. And the cost of treatment in terms of putting people onto treatment is going to only get bigger going forward. And that's going to obviously then have an impact on the fiscus and how we carve up our spending in South Africa.
Brad, also just looking at the role of business at this point in time, are you finding that there is appetite and there is willingness to carry the burden of HIV/AIDS and to carry the costs of treatment so as to avoid absenteeism, as to avoid a lot of the issues that do come to the fore when your employees are dealing and grappling with HIV/AIDS?
Yeah, I think that there are a lot of companies and sectors which have got very mature and progressive views on how to manage HIV. And sectors like mining, banking and financial institutions and your manufacturing sectors have been very responsive to HIV. But I think that there are sectors which need more assistance and also need to do more in respect of HIV. And a sector that I have in mind there would be, say, agriculture, for example, where we know that prevalence rates amongst workers on farms is very high. Farmers, unfortunately, do not have the financial resources to be able to respond in the same way that the mining sector, for example, can.
Yeah.
And so this is where we need to be engaging much more productively with government in respect of rolling out public-private partnerships.
Well, you mentioned PPPs. Do you think that is the big solution? We also know that government perhaps needs to relook regulation as in terms of who can actually employ doctors to be on site. We know that the mining industry in certain cases is allowed. Do you think that that is the next step forward? And we also know that the National Health Insurance Plan is very much in debate at this point in time. Do you see those developments assisting South Africans and South African businesses in coping with this pandemic?
I think that one of the areas that we really need to be addressing very, very proactively is access to capacity. And I'm talking about human capacity. We've got a shortage of doctors, we've got a shortage of nurses, and I think that the private sector can play a very constructive role in addressing that bottleneck. In turning to your question around national health insurance, I think that what needs to happen is that the debate and the dialogue around health insurance needs to become clearer, and we need to progress it, because what we're finding is that there is a behavior amongst some companies where they say, look, we're not willing to, or we're not enthusiastic about stepping into the fray as far as HIV is concerned, because we're going to wait until NHI has been sorted out, and that could be in the next 5 years, and that I think is quite negative thinking. And I think the other thing that we need to address as far as NHI is concerned is that if we do not reduce our infection rate of HIV massively, it's easily argued to say that NHI will be unsustainable.
Brad, give us some numbers. How much is it going to cost business and government to deal with this? And as you said, it is about prevention rather than cure. And clearly a lot needs to be done on that front as well, and business can become proactive in this.
There've just recently been 2 studies done. One has been looking back and the other one's looking forward around the costs relating to HIV. Those reports have only just come out. I know that the sectoral cost for the private sector already runs into the billions. If you look at what your insurance companies are already sustaining in terms of the impact of HIV and TB on things like health insurance and life insurance and so on, it's running into the billions. So I think that if we don't adopt some very proactive and robust strategies now about, for example, getting many more thousands of people are tested, and those that are testing positive need to get onto treatment sooner, then I fear that the costs may actually run away with us.